everyone, MindScapes717. I'm Leslie. This is Tania. We are in season 2. This is episode 4. Go back and listen to our Spotify. Catch us on MindScape717 so you can catch up to what we're doing. As of right now, I am once again going to attempt to start our actual podcast. Hold on. Forgive me. Give me grace. Okay. Okay. And nope.
It's not recording.
It's not? Okay.
You didn't hit the record button. Put the play
What did
button.
I? Oh, see what I mean by? Okay. This is what I get. This is what I get for thinking I know it all. Okay. Here we go again. Hello, hello, hello.
Hi.
It's Leslie and Tania from MindScapes717. We are here today to talk to you for our season 2, episode 4, and we're going to talk about relationships, specifically in regards to codependency, and a few other things. So,
Yes.
We are going to have 2 podcasts that are going to be up today. And 1 YouTube. So we're going to just put the YouTube together in one long one and just continue from there. So remember, you can get in touch with us. You can get in touch with us through email, mindscape717@gmail.com, at our website, MindScape717. Let's see what else.
TikTok, Facebook, Instagram, YouTube, Spotify. We are all over there, all over those for MindScape717. And these topics that are brought up this time in the last one, if you didn't listen, please go back and listen. It was on Spotify, and we tried to post a link, I think, for the audio because we didn't have a visual. But that one was something that was brought up. Gray Rock Method, all of the things that come with communication.
Right. We talked about the Gray Rock Method, the
Mhm.
Yellow Rock
Method. Mm-hmm.
And we talked about narcissism again. So if you want to go back and listen to those, the 2 others that we talked about with relationships, with narcissism, and then the different types of methods. And then we went all over the place. We digressed and segued into all sorts of different things.
Yes.
The last time,
Yes,
we were talking about DID and schizophrenia and what you can do or what you can see or what you can hear and understand. Now, we are going to talk about something that affects all of us in some way, shape, or form, and that is the whole concept of codependency, even not just in U.S. or individualistic societies, but in collectivistic societies as well, and they're seen as different. When we're talking about codependency. So in some societies, codependency is what is the norm, and in other societies, codependency is toxic, or it can be toxic if communication isn't the key.
So kind of just, this is the information that I've got from the Mental Health America website, and there's a lot of other fantastic websites, but this one is one that kind of gave me something that we wanted to kind of talk about in this way. So and I know we kind of talked about codependency. I talk about this on a daily with my clients because this is relationship based, right? Literally, this is also known as relationship addiction. This codependency, that's what it is. And this apparently has been, over the last 10 years, it has been an actual standalone issue. Because it's very much something that they've seen when there's addiction, when there's abuse. These are the things that they're seeing, the correlation between being codependent as opposed to dependency, that I know pop culture has made dependency a bad thing. And even growing up, it looks like a bad thing, right? Because we think substance use dependency. We don't really look at it as anything more than we are relying on something that's not good for us. but in all actuality, there is a separation of codependency and a dependency. So when we have dependency on people, and this is coming from the attachment theory, and again, I'm not here to convince anyone. This is just from how I work and what I've looked into and what makes sense.
Well,
this is
what is the attachment theory that we're...
So dependency is a good thing. Like, it's not that there's something specific to it. It's just when we're thinking about attachment theory and how they look at dependency, it's Leslie and I have a relationship. We're not codependent. We're dependent. I am dependent on her to show up for me as she is dependent for me to show up for her. We are dependent. Me and my clients are dependent. I'm here to show up to give them what I got, and they're here to tell me what's going on so we can work together. The dependency we have with relationships, it's a good thing. You want to be dependent. And when I was reading that attachment book, we want dependency with our partner, with friends, with family. We want to know that if I'm down and out and I consider you a friend or family or whatever, then I know that I can turn to you. That's the dependency that we're looking at as far as attachment theory is concerned. They're saying it's a positive thing, but it's true, because why be with the fucking partner if you're not going to depend on them to help you, right? Like, because then when we look at avoidant behavior or avoidant attachment, what becomes an issue in avoidance is they see dependent as a bad thing. They're thinking that you're trying to get into their independence to take it away from them. Mm-hmm. And this is where it's kind of, we could get into that more if we need to, but this is kind of just a segue into this idea of codependency, because it says here, codependency is a learned behavior that can be passed down from one generation to another. It is an emotional and behavioral condition that affects an individual's ability to have a healthy, mutually satisfying relationship. It is also known as relationship addiction because people with codependency often form or maintain relationships that are one-sided, emotionally destructive, and or abusive. And then this is the disorder was identified about 10 years ago. And it was a result of studying interpersonal relationships and families of alcoholics. So this is where it starts as far as what that looks like. If we give money to the person, if we have any kind of relationship that enables, like I like to say, shitty ass behavior, because that's what addiction is. It shows off this very selfish, very like me, egotistical. They're only looking for the thing that makes them happy. And I know that could be very destructive to a family. I mean, people give money and then they go drink, and then we're back in the cycle of doing really unfortunate situations. So this is kind of where we're going with codependency, because, and this is something that I think is important to kind of detach. And again, not here to convince. We're just here to provide information and how things can look like culturally speaking, because codependency is almost like you were saying, it's almost like a positive thing in a collectivistic, in like, it's okay. Like, and I've always said this, and I probably get a lot of whatever about this, but growing up in a Latina culture, we are okay with having family members that are alcoholics, as opposed to being like, oh, they're probably depressed and they need help. We allow alcoholism to be a thing. We don't really question it. It just happens and we move on. We know we have alcoholics. Both of my grandfathers were, and they passed away because of it. Growing up with that is very normalized. They're like, oh, well, their mom left, or this trauma. But we don't talk about that. We just say, oh, they drink and they left the family, or they did whatever. That's acceptable, as opposed to talking about trauma. If I say trauma, we're done. We are in the water. We're dead. We're not talking about nothing else. But when we talk about alcoholism, it's allowed. It's like almost like this rite of passage. Instead of trauma, we say addiction is more appropriate.
Is that because you can put something outside of yourself as like a blame, or is it just something that is accepted, even knowing that it can cause all sorts of issues?
Both of them. Both of those things. I think it really comes down to the fact that, and this is literally every day I see people, Spanish speaking, people that are first gen, anywhere in between, when we say trauma, they're like, no.
We don't have trauma.
Yeah, no.
I've heard that too.
It is beyond me when people are like, no, I don't associate any trauma. This is why I ask, Do you know what trauma is? Do you understand the definition? And according to your definition, would you say you have trauma? And then people are like, no. Okay, cool. And then we get into a conversation and all of it is trauma. And I'm like, okay, so we need to back up and we need to talk about what trauma is. But these are the things when we talk about addiction and stuff. We do get in an unfortunate cycle where we give people money. They come live with us. We let them stay. They steal. They get drunk. Like, this cycle is never ending, and we become enablers. And this is where it becomes very one-sided, and we don't get anything. It's not a mutual relationship.
No.
It's very one-sided, and they get away with the behaviors because we love them. We love them. We want them to be safe and
happy.
Yeah. And then we kind of get caught.
We assume we know what happy means.
Mm-hmm.
And for the most part, we don't.
And when it comes to addiction, because literally scientifically, they're not happier.
Right.
They're literally avoiding shit. They're running away. This is why addiction is such a fucking problem. People can't stop because that's the only thing that makes them feel nothing when they feel everything. It's just easy to not feel. I mean, girl, yeah. Would I love to be drunk all the time? Probably. But
we are drinking.
We are drinking, but like, let's, addiction is a different thing. But right, like, it's so easy to fall into those spaces when there is trauma and nobody wants to talk about it. No one wants to address really shitty ass behavior from the people we love. People don't, and we can look at addiction and say, yeah, I truly believe it's a problem. And they can't get out of it until they want to. People can't, people will, whatever. It's just really easy to go down that path when we're not talking about what we have to talk about.
We are also conditioned by society to believe that if your partner is down, then it's your turn to kind of be up and to support them in sickness and in health, that type of thing. I mean, if you're considering vows, and so when you're in a codependent relationship and you believe in the vows that you took, you think that you have to take on certain things in order to help the other person. But what you're not realizing is that it is not good. All you're doing is enabling the person. You're not helping them. You're actually hurting all of you. But you're not doing it on purpose. You're doing it because of the belief that was like given to you by society that, when your partner is down, you make sure you take care of things. And then you think that partner, when you're down, is going to take care of things. The unfortunate part of that is it's one-sided.
Yeah.
In a codependent relationship.
And then this is which is so funny you said that, because this says codependents often take on a martyr's role and become benefactors to an individual in need.
That's exactly right. So especially when you have an alcoholic as a spouse, that's what you end up doing. You
absolutely.
End up being the martyr, trying to take everything on, and then you get burnt out. And then you're the one who needs help, but there's no one to help you. There's no one.
Right. And
it becomes this horrible, kind of like a cyclical, toxic relationship at that point.
Well, yeah, because you're giving into the compulsion of the drinking or drugging or whatever it is. But then also, I hope we remember to post this on there, because it is very interesting how, and I was just reading as you were talking, because this has extended just addiction. Mm-hmm. And this has really gone into just what it looks like to be part of a relationship where it's the one-sided is the fucking problem. Like, that is where it becomes the problem, because you can be the martyr and you can do all of these things, but that other person is not going to reciprocate. They don't have the ability. And then this is where it is the addiction, but it's also that the abusive relationships that we allow, and we justify behaviors that are abusive behaviors, period. And we allow it to be, well, no, it's fine. They only did it one time. And in all actuality, they've done it multiple times. But we forget. we forget that it has happened, and we forget that it's going to happen again.
Short memories.
Yeah.
All of us have short memories.
Yeah. Uh-huh.
You know, I mean, you can say that about childbirth, too. I mean, Tanya doesn't know this, but, you know.
Never will I ever.
I mean, I can remember being in the hospital giving birth and I can remember everything, but not so much the pain. You don't remember that. It's just something that we women go through. Short memories. Just short memories.
Yeah.
And we keep hoping that we're going to find that love that we had initially, but it just isn't going to happen. And it just doesn't have to do, as Tanya said, with addiction. It can be financial stuff. It can be addiction to gambling. It can be addiction to, needing this is something totally different, like needing a set schedule that doesn't align with yours. And that's really more neurodivergent, I think, but it happens, right? So somebody may need to have a schedule, but you can't follow that schedule because you have a different job or something else, and it just causes a lot of problems. You're trying to take care of it, and the other person is rigid in their scheduling, so, and refuses to let anything come between that schedule, unfortunately.
Yeah, so I mean, this is obviously, we could talk about this forever and ever, because there is 10 years of information that has come out, and it's really across cultures, we can look at how culturally this is probably not a thing that people want to associate with, because they're like, no, well, family is family. And honestly, because with the population I work with, there are a lot of first gens, and we talk about the obligation that is given to us as first gens. And it's one of those unspoken things that it's not done on purpose. It just happens because of survival reasons. Like, we become the middleman for our parents and the culture. We become this, we're going to translate for you, and then we're going to live our life on this end. But it is really hard to do that because there are so many things that we are supposed to be doing. And it becomes a codependent relationship. I truly believe that. And this is where it sucks, because it's not even done on purpose, right? And this is where I think a lot of that information that was in there is this need that it fulfills for some of us. There is a sense of, because they were even mentioning low self-esteem. That is something that they're looking at as a characteristic of the person that is the codependent, right? Because they need the other person to fulfill whatever it is they're looking for. Because we do, as enablers, we allow that, and we give them this space to do the power, the control of doing the thing that hurts everyone.
Yeah, we talk a lot about relationships, as in like marriage or boyfriend-girlfriend or girlfriend-girlfriend, whatever you identify with. But we don't often talk about things like boss-employee type relationships or supervisee and supervisor relationships. Those can also become codependent. And burnout, as you well know, I'm sure all of you have heard about burnout by this time, can happen rapidly with someone who is the codependent and doing all the work, and then just feeling overwhelmed with things in the end.
Right.
And the boss not understanding that, I mean, they've been doing everything up until now, so what's the problem? So there's a lot of that going on, and we had talked previously, the reason why I even mentioned this is we had talked previously last season about boundaries, about setting boundaries, and it's especially important in any relationship that you have, regardless if it is
platonic, romantic, anything in between.
Exactly. You know, that you set boundaries not only for yourself, but for whatever you need to set those boundaries for.
Because that's what it is, a boundary. And as much as we can say this, and again, this is something that first and foremost, I am all for no contact. I am number one on that list. I believe the power of no contact when there is no contact that will be beneficial for both parties. This is where codependency comes in. There's going to be one party that's not okay with it, and guess what? No contact is great. But then there's people that fall in the middle where they still want that relationship, and that's wonderful. And the boundaries are never a hell no or a fuck no. That's not the only answer. No. And people need to understand that, and I literally have to say this repeatedly. Boundaries does not equal a fuck no. Those are not interchangeable. You can say no contact on purpose if that's what you want to do, because good for you, more power. Or you say, you know what, I want to still have this relationship, but how are you going to protect yourself is really the only thing we're trying to understand here. You are allowed to keep contact with people that you love, especially family. We are biologically engineered to want that with our people. Genetically speaking, there is a huge connection if we think about what we're made up of. Not only DNA that we share genetically, but we also have the environmental, the nurturing that we grew up in. I don't care how working in foster care was an eye-opener for me, because no matter how abusive the home environment, they always want to go home.
Yes.
And that to me was like, what the fuck? Like, it was like one of those moments where you know it until you see it, and you hear these stories and you're like, why would you want to go home?
Why would you want to go back to that?
Why would you? They have not changed. All that happened is you get removed, you go back in, it's the exact same fucking situation. Because they're adults and you're the child, and now you have to suffer the consequences. Literally working in foster care gave me this whole, like, it really doesn't fucking matter how abused or neglected or abandoned you were. You're always going to want to go back to that. Now, do we build walls? Do we learn to adapt? Yeah, absolutely. This is why avoidance is the real thing. But no matter what, there's always this push to want to go back. And you can try to protect yourself by building these walls, but it's not even protective. It's just going back and, like, putting yourself in a bubble because it's too hard to manage anything else. So we want that. It's not boundaries in these relationships, platonic to romantic, anything in between, professional, personal. It's just making sure you protect yourself and what is your limit. Because you're right, burnout.
Yeah.
We live in the world of burnout with people that we don't know how to talk to. You want to give and give and give, and you do. And then what the fuck happens after that?
I mean, on TikTok, the past couple weeks, I've talked a lot about task paralysis. You know, where you get so overwhelmed that you can't do anything. Like, nothing. Especially when it comes to work or any, like, chores that you have to do. You keep putting them off. Keep giving excuses not to do anything. This accumulates to burnout. Mm-hmm. So if you can recognize some of the symptoms, you're becoming more self-aware, then you can do something about this. And really start thinking about where you are. Are you... Now, again, Tanya, you were talking about, before I go there, you were talking about different cultures. Like, if we're talking about a collectivistic family, you know, a lot of collectivistic families are so family-oriented that this is the way they are. This is just who you are, how you deal with things. And we're not really talking to you because this is how you grew up, right? This is how you grew up. However, if you are feeling burnout, resentment, if you're feeling upset about certain things, then we are talking to you.
Well, to be fair, we're talking to them.
Yeah.
They're not going to want to understand this because you're right. But I think naturally, and this could be just my own bias, and that's fine if it is. I'm going to say it anyway. We still fucking feel that.
Yeah.
Even if we're not going to talk about it, we still fucking feel it. Because at the end of the day, we don't know that that's wrong. How they treat us. We don't know that that's not appropriate because it's been normalized. And this is where normalized fucking behavior becomes the problem. Like, it's not okay to abuse someone. And in whatever relationship, you talked about work.
Mm-hmm.
A boss should never make you feel like you have to keep doing things to like get approval or like be the good one. Like, no, you do your job and you move on. Like you should not feel like your self-esteem is being impacted because you are a whole person. You have all of these feelings that you're allowed to have. But we are talking to all of you because everyone feels this. I don't give a fuck how strong you are. Yo, this happens to everyone. I do not believe that any system is going to be okay with being treated that way. Now, you won't want to talk about it. You don't want to admit it. Again, I literally see this every fucking day. I am a workaholic. I'm working on it. I'm trying to take time off. Yes. But at the end of the day, this is literally what we talk about. No, they didn't do anything to me. Okay, fine. And then you're going to talk to me about how you're feeling. Why is that not a thing that you look at for correlation purpose? Like, why? Why are we here? Why are we talking about it? No, it's fine. It's fine.
I'm not sure that some societies are even studying this because they're not even thinking that this is part of their culture.
No.
That's why I was saying it's not even, like you said, it's normalized behavior because society has
told them that this is the only way to live. But it's not. So we are talking to everyone. It's just whether or not you want to admit it to yourself or whether or not you want to talk about it. That's where it's up to you. I tell my clients, it is up to you what you do with this. But if you're going to come in and say the same thing over and over with no change, what's the fucking point about talking about it at this point? Because you know it's hurting you and you understand that there is something not right with it. So then, again, boundaries, protect yourself. Maybe you give just enough and then you move the fuck on and you give yourself the rest. I don't know. Whatever that fits for you in the situation, you just have to protect yourself. Like, whether or not you can talk to someone, whether or not you can do anything, that's up to you. Like, at that point, I even tell my clients, if you don't want to do anything, that's fine, but what are we doing here? Like, we can't move forward if we're not really looking at something to work on, because there's always things to work on. Yes. And again, I'm in my therapy weekly, okay? So I know there's always something to work on. I tell my clients, I'm like, I need help. I can do this shit for everybody else, but not for myself. There's always something we can work on, and there's always something that we can do to better support ourselves. Selfish. Self-care is not selfish. We have to fucking take care of ourselves. We just can't keep doing this because it's not going to take us anywhere. It's just not. It makes us physically sick.
Yes.
Physically sick. People come in with the worst pains, and I'm like, well, tell me about your home life. Tell me about what's going on emotionally. And then they like fall apart. And I'm like,
and that's true with culture too, because there's certain cultures that everything is shown up physically rather than emotionally. And so that's a very good point. Codependency is really hard, mainly on one person, and it's that hierarchy, that lack of partnership, lack of communication, lack of boundaries, that causes all sorts of different problems. And I mean, alcoholism is like a huge one, or drug abuse, or anything like that. I mean, I remember when I was told, I was working nights, and I was told if I didn't come back with alcohol, like beer, it didn't even matter at that point, then he would be really upset, and I would come home without alcohol because it was after midnight, and in our state you cannot buy alcohol after midnight in stores or whatever. And so I would get the silent treatment. I would get just horrible attitude, and I wouldn't want that. I would want the nice, friendly person, but I didn't realize that was the manipulation that was happening at the time, because you're in it, right? And I mean, I did realize it later, especially when I found out he had changed our pure water filter with pure gin. So
God.
And I and at that point I had to actually stop and say to myself, whoa, because he's been drinking this in the morning. It's all day long. I mean, something is going on here, and I have got to figure it out. So I understand that sometimes you're just not that aware because you're so busy being the martyr, so busy trying to enable and
make
back
things
the
work.
happiness back and take care of the kids, whatever you have to do, dogs, animals, whatever. That things happen, but eventually things catch up to you. And
they always do.
There's this power differential that they have the power and they're using it against you. So please be careful out there. Recognize things. Understand that boundaries need to be made. No, there are relationships where you can come back from this. I'm not saying you can't. But those boundaries and communication, you have to be in the same place. Both. You really do. You have to both want it.
Because it's a learned behavior, right? Like, and we could talk literally about this all day, but like, it is a learned behavior. It's something that you see growing up, and the way they're looking at it is so interesting to me, at least, on how they're doing this research, because they're looking at all relationships across like cultures and issues. Like, we learn, and this is why I believe so much in attachment theory, we learn how to fucking relate to people because of how we're raised. Like, if we look at those orphans, like, they grow up with severe mental health issues. Like, we know this shit to be true, but yet we're not connecting the dots, and we're not taking a step back to be like, all right, I can't change that, but what can I do to not change myself, but what can I do to better improve the situation for me?
Right.
But again, that's selfish, and a lot of people, I say selfish all day, every day. I say, yes, I am being selfish. I'm taking care of me, because selfish is always coming with the negative idea that, like, I'm doing something to hurt someone else, but that's not the case.
Yeah. You have to take care of yourself, because if you're not going to do it, who is?
Girl, this is why physically people are sick. People are like, oh, my neck hurts, oh, my stomach. Let's talk about it. People want to be like, no, I think I just ate something. Fucking tell me about your day.
Yeah, she gets into it every single time.
I don't.
But it's so funny. We can go anywhere and people will just start telling her stuff.
And then she leaves me alone. Then I'm stuck with these people. I'm like, I don't want to be here. They approach because Leslie's just all smiley. It's not me. It's not me, because I don't smile at people on fucking purpose. She does, and then I get stuck in. I'm like, fuck. All right, now you're telling me your whole life. But
times.
It's a thing for her, because then someone else pulls her into a conversation. I'm stuck over here listening to fucking trauma. Yo, every fucking time. But again, this is why I do what I do. People go through shit every day. It's not perfect, and it's not going to be just overnight that you're going to understand things. But you just have to understand that there's a problem. There is a fucking problem when you don't feel safe. You don't say shit. Why? You've never felt safe to say anything. You cry by yourself. Why? Never felt safe to say shit. You have to understand these behaviors, or learn behaviors, but also you learn very quickly who to tell and who not to tell. And if you live a life where collectivistically you don't talk about it, then you're going to die from the inside out, because that cannot stay in your system and you think you're going to be okay. People are literally dying at a very young age. Genes mutate, shit happens, diabetes, high blood pressure, fucking cancer, they're linking to shit like this. You can't, I am so convinced that this is a thing. And if you don't think so, that's okay. I always say I'm not here to convince. I'm here to provide information, but it's so important for you to take care of yourself in whatever way that is. And it doesn't mean go and buy yourself something expensive. It's just, how do you say no when you don't got it?
Right.
How do you say no? How do you put it back into your savings account before you give anybody what you don't got?
Exactly.
Because I've been there, done that. I know how hard that is to walk away from that. But you have to. You just have to. And if they don't want to be your friend or your family or whatever, then boundaries. You don't need them. You don't need them.
If you want them to be, is what I'm saying. If you want
them if you want them, you have to, But if they want to fight you at every chance, fuck them.
Yeah.
Fuck them, because it's not going to work. They're going to be sick all the time.
Yeah. So this concludes season 2, episode 4. But we are, for those who are on our video, we are going to do another podcast very soon. I'm putting it on pause, and we'll come back in just a moment. Okay, we're going to start resuming the next podcast. So again, please be patient with me.
A little bit. A little bit.
A little bit. A lot.
A lot of it.
A lot. I'm so bad. It's so bad. Okay, so here I go. I'm going to try this again. Hello, hello, hello.
Hi.
MindScapes717 again with Leslie and Tania. We are now on season 2, episode 5. And we just finished talking about codependency and mental health, with culture involved as well. And so we thought we'd kind of continue along the same vein and talk a lot about diagnoses in mental health and how culture affects that. So where are we going with this?
So we were literally just trying to catch up with this conversation. So because of how we're moving along, we started with narcissism and kind of went into like grief a little bit, and then codependency and a little bit more of what that looks like. So maybe talking about mental health in relationships. If we are in a relationship where, and again, when we talk about relationships, it's not just romantic.
Right.
It is literally platonic to romantic and everything in between. Personal, professional, any kind of, we have so many different relationships, right? And it's just not the idea of it being a love, like a romantic relationship. There's more to that. So mental health, mental illness in relationships, I think coming off of the codependency, because that's a disorder. It's a true disorder. It comes with so much more. And when we think about what mental health is as an issue, there is a lot that comes with this. And I know we talk about trauma, and a lot of the things like personality disorders, like narcissism, it's rooted in trauma. And we can be very empathic to people that have been through some shit, especially if we love them, especially if we want a relationship. We could be very empathic, and that's fine until it becomes a codependent relationship, and now we are the martyr and they get to treat us the way they treat us. But moving into the space of where mental health is a problem, can be a problem, is a problem. And I know we kind of just mentioned, like we were talking before we turned it on, like bipolar, right? We can talk about anything from severe anxiety to bipolar, to narcissism, to borderline, to schizophrenia, all of those spaces. It is really difficult to have a relationship with mental health, because that's what we're trying to do. We're trying to incorporate a relationship that's healthy and secure with individuals or situations where
they may not be healthy or secure. They might be a little unstable, but we love them. Right. So
and that's a really hard thing to kind of reconcile, because people want to stay to help and want to create that safe space for that person.
Right. You know, I was thinking a little bit about an us versus them type of thing. We create new labels all the time. And the newest label, of course, is neurodivergent, and then just normal.
Right? Was it neurotypical?
Typical, yeah. Neurotypical and neurodivergent. Which, again, I think kind of pits us against each other rather than allows for like a sort of a better communication or a better understanding. It just kind of pits the two together against each other. And that's one of the reasons why I'm against labels in the first place. But sometimes labels can actually help us understand another individual, especially if that individual is going through something. They've had a traumatic childhood,
right?
And they're just now starting to deal with it. And there's all sorts of new things that are coming up with, the whole concept of autism.
Mm-hmm.
There's just so many, females and males see it differently and have different reactions. And there's just new ways to look at autism. And there's so many more people that have autism than we originally thought, even 5 years ago.
Yeah. And that's along with ADHD.
ADHD is the other, hot term.
These are some trigger shit right now.
So, so we're talking about these hot terms: ADHD, autism, neurodivergent, neurotypical. very hot terms. 20 years ago, bipolar was the very hot term, and everybody was being diagnosed as bipolar. What is bipolar?
So bipolar, there's two types. And there is depressive episodes where we are as low as we can get, and maybe we try to harm ourselves and no longer exist, because that's how low we get. Or we get super duper high where we won't sleep. Yeah, the manic. We don't sleep. We're very grandiose. We have all of the energy. And mind you, we haven't slept. We're not eating well. We're not really... we're not doing anything of the normal things that we would do to get energy, to be high energy. These people in mania are severely, like... It's almost...
like they're high.
Yes. On like some real high shit. Yeah.
Right.
And nothing has changed. It's just a manic episode. Mm-hmm. And then there's a level below that, which is hypomania, which is part of like... That's a differentiation between bipolar 1 and 2 is the hypomania, where it's still very much grandiose, but it's not as significant as like a manic episode. So the ups and downs, and I know people... This bothers me now as a clinician. It bothers me that people are like, oh, you're so bipolar. Or I think they're bipolar because they're happy one moment and then sad the next. All right. Let's not do that shit, because...
Let's not self-diagnose.
We're not. Or diagnose someone else just because you don't know what the fuck it means. I don't like it.
Exactly.
People very much suffer from bipolar. And when you see it, it is very drastic. I have a couple that are bipolar. And I have a couple clients that will... deny, and I'm like, cool. I'm not trying to convince you of anything, but you can see it's so drastic. It's not like you're sad one moment and then happy the next, because honestly, I think it's a very normal fucking spectrum to go on a literal daily basis. But if you wake up and you didn't sleep well and you're a little tired and you're a little cranky, and women, I'm going to have to say this one because I feel this shit. When I'm about to get on my period, some shit makes me so angry. And then I want to cry. And then I'm like, oh, this is my period. I'm totally fine. But then that's a normal thing. I feel like hormones and stress and mood, like all of these things are impacted. Because bipolar is a mood disorder. It's so like this. It's not...
There's nothing in between.
People, it's just not, you're sad and happy in one day.
Unless you are medicated properly, and it takes a while to figure out the proper medication.
Because then if you got other shit too, it could be a free-for-all to figure out how to better support it. Because mood disorders are mood disorders for a reason. And a lot of people will be diagnosed with mood disorder when their actuality is bipolar. Because, right, we have to figure out where we are in the spectrum. And I think now... it's getting better, but people are still using it like, oh, I'm just kind of up and down. So what? I am too, but it doesn't mean I'm bipolar. Like, it's not the same thing.
It's not.
This is where...
It's been a pop, like, psychology term lately. It's a household term now. Oh, you're being bipolar. No. If you've actually seen it in action, which
it is
both
very
of us
scary.
have, it's, I've had clients that were bipolar, and let me tell you, when they think they're feeling better and they go off their medication and everything ends up like going crazy again, it's a struggle. It's a struggle even as a therapist to get that person to understand, to see, to feel.
And then people are they're just not happy with the idea of bipolar.
Right.
And people want to ignore it. And I'm like, look, I have a client right now. We have differences of opinions, and I'm not arguing. I say, okay. Mm-hmm. And they're like, why are you saying, okay, I'm not here to convince you. You feel better. I'm glad. Let's do this. But you go from wanting to harm yourself and not exist to wanting to rule the world.
Or go shopping with money you don't have.
Because those are the risky behaviors we look at.
Debt issues. And so what happens if you're in a relationship with somebody who has a mood disorder? And how do you deal with that?
It's a good question. First and foremost, that other person needs to be in therapy as well. This one you can't handle alone. Being in a relationship with someone that suffers, and it's a suffrage in mental health, when you deal with something so intense like bipolar personality, you're coming from a very traumatic place. Like, that's really difficult. You need to talk about it so that you can understand what is the best for you if you want to continue. I literally have a client that's going through this right now. Their person is very in the depths of a personality disorder. And they're trying to figure out what to do. And it's very difficult because you can't say leave them. You can't say love them harder and they'll change. There is no change for that person. You're just going to have to be ready with your armor to protect yourself. And again, it's not a selfish thing. You just have to be ready because that shit is deep. And I agree with Leslie. Diagnoses kind of pissed me off a little bit too. Sometimes I'm like, this seems aggressive that we even have to go this route. But at the same time, I think as I work more with it, I'm like, this will give us a little bit of space to figure out how to better support someone with medication and the psych. Yeah, like yeah. I'm able to like say, okay, this is what it is and this is what they need and this is what I'm doing. Granted, do I use the same thing for everyone? Absolutely not. I believe that I am more eclectic than anything else. I do not subscribe to one modality because I don't think that that's true. We're all very different. What works for me is not going to work for someone else. So I'm not going to present something the only way that I know. For example, journaling is my worst. I hate fucking journaling. I can't do it. I think it's stupid, but I can't do it.
And I love it. So.
And so many of my clients are like, I'm a journal. I say, girl, do you? Because guess what? I'm not going to tell you to do is journal because I fucking hate journaling. I tried my entire life and I'm so bad at it. People love it. I'm like, use a fucking journal. There's such cute ones. Like, get yourself apps, a cute one.
There's
all the things.
Yeah. So there's.
But again, I don't say journaling number one. I said, how do you express yourself the best? Is it speaking out loud? Because I talk to myself. Now, I look crazy in my car, because I'm going to be very honest. If I'm not blasting music, I'm, like, processing my day. And if I'm anxious about something, I process it out loud, and I question the anxiety. I believe of making anxiety an outside factor, so I talk to it. I can't journal. I can't do it. But these are the things that you can consider when you're in a relationship with someone. What do you need?
For yourself in order to...
What if you can't talk to your partner? Right. They're in a manic or in a depressive, but, like, fucking knee deep in it. What are you gonna do? You can't just sit there and wait for it to pass because shit, that could go on for a really long time.
So yeah, what are you gonna do for yourself? Mm-hmm. How are you gonna handle things?
Right.
What do you think you need to say or do? And this is something that you can work out in therapy, but there is support groups also.
Oh gosh, yeah, NAMI has really good ones.
Yeah, and for this reason, if you're in a relationship with someone and you want to continue that relationship with someone regardless of their diagnoses,
right,
please consider joining. Please, because finding out different ways to help your partner, but more importantly, help yourself.
Yeah.
Because it is traumatic to see as well as understand that your person is going through something. Yeah. You know?
Because then they take it out on you. You are going to become the reason that they're depressed or they're manic, and you mentioned the money thing. I think that that's a huge issue. Yeah. What if they go on a binge and they spend all their fucking money?
What are you going to do?
You got rent to pay, you got bills, you got kids. What are you going to do?
Yeah. So there's things you have to do to protect yourself and your family and your kids and your house and, you know, all sorts of things.
Yeah.
But this is something that needs to be communicated as well. Again, there's, you know, setting boundaries and making sure that you have a community of support. It is out there, no matter where you are. Even in rural areas, you can go online.
Nowadays, you have no excuse for a support group. There's all kinds of shit, even overseas, like...
Yes, and overseas especially,
support groups, if you're doing therapy, seeking your own therapist, like, there are so many factors that can be an issue. But then you could become the reason that they're going through something. But you have to express this. And again, if you're not sure that's a problem, it's probably a problem. Yeah. Like, you know something ain't right, and you're trying to work through it, and you're trying to communicate this. it's very easy. And then this is what we just talked about in the last one. Codependency literally thrives in those spaces, right? Because we become the enablers to something that, yes, is it a suffrage? I think mental illness is no fucking joke. Like, people literally die because of this. And it's one of those things where it's very difficult when you don't have the support. Again, if you don't have your therapist and you're looking for one, I know it's hard. So in all fairness, I get it. But also touch in with their therapist. Sign a consent.
You know, I have to say that I was watching a TikTok video this morning, and there was a gentleman on there who's a therapist. And he was saying, look, you know, we, as single people, what we do is we date, right? We go on Tinder, we go on some apps, we do whatever, and we go on these dates, or it's an arranged date or blind date or whatever. It doesn't really matter. We go on these dates. And he goes, I think we got the language wrong. He said, what we should be doing is vetting. Like, what we should be doing is, like, asking the questions to see if we have our values aligned, or if we, you know, can get along in certain situations. And then we can go to dating and casual dating. Because once we hit the dating mark and we're solidly dating, even if it is casual, it's a relationship. And I know a lot of people are going to give me flack for that. But, because, you know, if you're dating, it's not a relationship. Oh, yes, it is.
It is.
You're dating the person, no matter how casually.
It is. Right. No, but I totally agree with that. Because a lot of people are scared to ask, do you want kids?
Right.
I think that's the number one fucking thing. If it's not on your profile, do you want kids, is before we go anywhere. But those are very fundamental values that could cause issues in a relationship. You lie, someone's going to fuck around and find out.
Right.
That's just what's going to happen. And this is one of those things that I think is super important. Be like,
one of the questions should be, well, how do you communicate? I mean, now, even if I seek employment, I ask that employer, because I am vetting them. You know, do I really want to work in an organization that isn't going to communicate with me? So I ask them when it says, do you have any questions? Oh, hell yes, I do.
You got a lot of questions.
I want to know how you communicate with your employees. Absolutely.
Oh, absolutely.
And it should be with relationships too.
Absolutely.
So,
and listen to them when they tell you.
Yes.
People are going to lie, because been there, done that. I've been on dates, or I've matched with people that will tell me what they think I want to hear. Listen to that. Start doing your math. Make sure your math is mathing, because they're going to show you real fucking quick what they're not willing to do.
Exactly.
And they will be honest with you with their behaviors. Behaviorally speaking, look at that shit.
Actions speak louder sometimes.
Girl, most times in dating is what it comes down to. But yeah, they will show you who they're there for. Are they there for you or for themselves? Because you can definitely be like, nah, sorry. You're in conflict. How they resolve conflict is so fucking important, because
you want to know these things.
Because you don't know who you're talking to, and you do not know how they're going to do that with you moving forward.
Exactly. Once you can figure kind of these things out and feel like you are aligned, even if that person does have a diagnosis, if you're aligned in your values and your actions and behaviors and the way you communicate and your conflict resolution style, then you have a hell of a lot better chance of surviving.
Oh, absolutely.
You know, so again, that's not selfish. That is protection.
But it's also, it's going to give you the tools to make it work. There's going to be ups and downs, ebbs and flows. I think any relationship, when you cut out mental health, there's still issues, right? Let's say two people come from really loving homes. They're very secure, maybe a little bit of anxiety, a little bit of depression. If we're talking the lower realm of kind of what mental health looks like, even people like that can have issues. And then you start throwing these things that are rooted in trauma that, and again, I'm not saying this because I believe that this is true. Start talking to fucking people and listen to their story. Like, people grew up in abusive homes. They had abusive relationships. And the people that abuse us the most is their family, when that is the cultural norm in that family.
Right.
Very passive aggressive that we mentioned last time, the gray rock, all of these things that we go through, these are learned behaviors. We learn how to socialize and communicate with the people that raise us. If it's not done appropriately, I grew up in a very hostile environment. Very hostile. Everything was yelling. Everything was an argument. Everything was escalated to the 10th degree. For fucking what? For nothing. It was for nothing. I don't like it now. I would never do that with a partner. I would never do that with anyone, because I think that doesn't resolve anything. You have to be ready to look at things and to understand what's going on to better support your system. Your system is what cannot take a hostile environment. If that's what you were raised in and that's what's normalized, then you don't even know it's a problem until it becomes a problem and you meet your match and they make you feel bad about yourself. Mm-hmm. There's always a downfall to stuff, and you just have to be ready to protect yourself, because that's all. Boundaries is just protection to know how to relate to others. Right. You're yelling at me? Then we're not going. I don't need to hear this from you. We can wait until you're ready to speak to me like an adult, and then we can resolve this issue.
Now, some people, we say that. It's so easy to say that. It's so easy.
Oh, I'd love to be on this side of the couch. Exactly. That one is harder.
In fact, I think that there's a lot of people overseas that talk about mental health as couching, like sitting on the couch, right? But it's very true, nonetheless. But anyhow, I think it's interesting that we say, let's talk later, because I need to cool down, or I need to calm down before I can talk to you, or I don't, this isn't working for me. We need to step back, and then we can get back together and talk about this like adults. If you are with somebody who is in the middle of a, what do you want to call it, a flare,
a moment
of a mental health concern, they're not gonna take that too well. So
right,
remember, plan things out. You have to protect yourself and your mental health just as much as you want to protect them too.
Yeah.
So if that means actually leaving the house, all you can do is say, look, I'm feeling threatened right now. I'm not feeling calm, and I want to have a calm conversation with you. So I'm going to take myself out of the situation,
right,
and calm down, and then I'm going to come back and we can talk about this. Please give me that. Sometimes they'll give it to you, and sometimes they'll just keep on at you. But make a plan for yourself. And
this is where you talk to a therapist, to yours,
exactly,
to your partner's therapist, to a couple's. And I know we kind of say you don't need to do this, or you need to do. At the end of the day, it's what works for you and your partner and your family. Like, we can give all of these things to you, but if that doesn't work, what is the thing that works for your partner who is struggling with their stuff? And then what works for the couple, and then what works for you? Because that's who's important. There's 3 clients here.
Yeah.
How are you giving?
Don't make yourself a martyr.
Yeah.
Don't make yourself a martyr. Like, you got to take care of you too. And so.
Yes.
And that means that you don't have this power differential, right? So that you can come together if you work on it together and balance each other out. But it's hard. It's that relationships are hard. Anybody who tells you otherwise is lying through their teeth. So you do what you gotta do. Mm-hmm. And that's what it comes down to.
Because you have to do the best by you, the best by your person, if that is a relationship you want to maintain.
That's right.
That is the caveat to everything.
I think I said this before, but when I was doing therapy, if I had a couple coming in, I'd ask them, okay, are you here because you want to stay together? Are you here because you want to separate and work things out? Or are you here because you want a divorce? Those are the 3 options. So tell me what you want. Because if one person is saying, I want a divorce, and the other person is saying, I want to stay together, there's obviously a problem.
This is why the fuck I don't do couples. Hell no. That's a hard one, because you're right. It's a fundamental difference here.
Right.
It's a fucking problem.
Right. And that power issue is going to be like a continued issue.
Yeah.
If that person wants out, they're going to do anything they can to get out. And so the person who wants to stay is going to feel rejected,
abandoned,
neglected, all of those things.
Right.
So it's really hard. Relationships are hard But it's really hard to make sure that you maintain a balance in a way that works for the both of you, or for all of you if you're in a polyamory type of relationship or whatever.
Yeah.
But just take care of you and make your plans.
And there's nothing wrong with that. And I know it's almost like, well, if I have to make a plan, then something is wrong. Yeah, right. If you're not safe, then something is wrong.
That's
and
right.
it could literally be more of an emotional safety issue. And it doesn't need to be to the point, because I know people love to be like, well, they don't hit me. All right, cool. But how do they talk to you?
Right.
And how do they treat you? And then how are you feeling after those encounters with this person? Because a bruise will heal, but that shit that people tell you...
You can have scars on the inside.
Ooh, those never heal. Those don't ever go away. That is something that stays with you. And if you feel unsafe in any way because of words or how they interact, or even
their actions, or
even
like
if
trying
it's not
like physical towards you, if their actions show you you're unsafe.
They don't have to raise a hand at you to be abusive.
You
oh no, that's what it is. You don't. There's so many levels of unsafety, of feeling unsafe, and I feel like that's one of them, where like people want to go straight to like, well, they don't hit me.
Right.
Bitch, no, okay, but then how do you feel after an encounter?
Exactly.
Do you feel like a piece of shit? Because then maybe there's a problem. And this is where communication needs to happen.
Yeah, exactly.
Yeah.
Well, I think that's the end of our...
Because again, we could go on forever.
Yeah, we could.
Don't get me started on some shit. I do this every day, and I can do it some more.
We really could. So we can go on all day. We can talk about this stuff, and we do.
I think that's the worst part. I don't think you guys understand. We talk about this shit all the time.
Right. So right now I'm going to say goodbye to our podcast people, but the video people, YouTube people, you're still on for a second. So again, I'm just going to ask for a little grace, because, I'm so good at this that...
Yep. All right, bye, guys.
Well, yeah. Bye, guys. Have a good one. I just deleted the music.
Oh, Leslie, that's funny.
Oh, my God. I'll find it again.
Oh, shit, that's funny.
So, yeah, we need a blooper session here because, because that's what I do. And then she laughs at me.
I can't help it.
And then it's a forever joke.
I'm surprised she didn't say fucking hell, because that is where we go every time.
That's because
she tries to be fucking proper, and I look like a fucking crazy person dropping these F-bombs, but then you don't even know behind closed doors what the fuck she be talking about. I look crazy. I do every time, and I'm ready for it. It's fine.
There's nothing wrong with the F-bombs.
No, but you don't even know. You don't know, but that's fine. Somebody's got to be a grown-up here, I guess. It's not me. It's not fucking me, that's for sure. So it's fine. It works. Toodaloo, everyone. Bye.